Good morning. Uh, Saturday morning, and it was a lovely walk this morning. I was up bright and early, going for a walk, so all good. Summer seems to be here. I'm actually just wearing a t-shirt at the moment, so it's got to be here because I'm constantly cold, as most people are aware, cold-blooded, and yeah, so I'm actually looking forward to the summer finally. The rain has stopped, and it seems like it's gone on for months. It really does. It obviously hasn't, but yeah, it feels like it has anyway. Um, Health anxiety. Look, I've spoken about health anxiety. I don't know how many times before, and I suppose this week has kind of come to a head, really, and things have got so bad that I went to the doc. I had to pay for an extra long consultation. I've said it before. If you're in the UK, despite having to wait weeks to see a doctor, you don't have to pay. So think yourself very lucky, because for me, for an extra long consult, it's $140, and it was quite funny because look, I went into the doctor. When I left, I was walking back home, and I got a phone call from the doctor's surgery, and she said, "Oh," I thought, "Oh my god, I've got to pay or something." Now, in the past, you used to pay as you left. I guess too many people were absconding, so they didn't do that. So they changed it so you pay up front, and I thought, no, hang on, I've already paid. And she said, "Oh," she said, "because you've had to, an extra form was filled in, I had to pay another $10." So made me laugh. I'm just thinking, oh, all right then, more money. So look, it's in many respects, I suppose it's similar to the American system where you pay for everything, literally. So if I had to get a sick note for work, for example, I would have to pay for that privilege, and it usually costs around $200. So things aren't cheap here at all, and you do get some back if you get a Medicare rebate, and but not everything. A lot of places, a lot of the people who have been here a long time, that they're on a system which is bulk billed, so that they tend to you're not charged individually for your consultation. It's billed in bulk load of patients, I guess. I don't really know much about it because that's not something I get. So most people, I guess, these days are private, and that's it. You pay, and if you are bulk billed, you're very lucky. I can go to an urgent care. There's one near where I live, and I am bulk billed for that, but it's not something I use often. And obviously, if you go to the hospital, as a rule, A&E, you're not billed. So, you know, so it's not all bad. It's kind of, I think it's a cross between the British and the American system. It's between the two, really. So, yes. So anyway, I went to the doctor. I needed we'd arranged for this appointment before I went on holiday, and he said, "Come in and we do." He wanted to do some questionnaires online about my health anxiety, in fact, and I had to answer a number of questions. He asked me a number of questions as well about how I was feeling, how it is to cope with it on a daily basis, and all the rest of it. And he came up with a random number at the end of it, and he said, "You need to see someone." So I've been referred. I think they were called Psych West, and I think it's going to be. I guess it'd be like a CBT thing, cognitive behavioural therapy. It's predominantly dealing with anxiety, health anxiety. I have a lot of other anxieties as well, as I said to him. He said, "But this is something that's you. It's part of you. I obviously have what's called high cortisol levels. Now, a plan was put in place, in effect, for me to have 6 consultations with this organisation. Now, again, you pay for that. So you pay between $170 to $300, depending on the level of expertise that you want. So that's down to me. But he's arranged for the 6 consultations, and it will go from there. And it depends how it works out for me. I mean, I don't know much about CBT. Who knows? I just do not know. But health anxiety wise, it's got to a point where, look, every morning I'm waking up at 3 o'clock and I cannot get back to sleep. Now, as someone who suffers with health anxiety, I've Googled that, and the outcomes are from minor to major, just put it that way. And because I'm an older man, I thought it might be prostate related. Now, I've had a PSA test done, that was done within the last sort of 6 months, and it was 0.87. So it's not that. I do get up to use the toilet maybe once a night. I feel like I'm in a doctor's surgery now, but anyway. So yeah, I get up once a night, and I stop drinking before 4 hours actually before I go to bed, and just to see if that makes a difference. And it has actually made a big difference. So I'm not getting up, so I don't have a full bladder, which is good. And I've started to take some raw honey, just a teaspoon, before I go to bed, because I'm assuming it's to do with possibly your blood sugar falls too low, but this teaspoon of raw honey helps to keep it at a level that makes you not wake up. I don't know. I still wake up, so clearly it's not working. And I was directed to a lady from the UK on YouTube who basically said all the anxieties and worry that I have are just exacerbating the situation, which I knew anyway. And health anxiety sleep anxiety is something you just have to get over. Because mine's now chronic, it's about resetting sleep patterns, etc., etc. Hopefully that will be done with therapy, I hope. But who knows? As I said, it's not something I've done before. I've got a spot just there, and it's been there for a number of weeks. Again, I feel like I'm in a doctor's surgery. It's not intentional, believe me. It does help me, so maybe it's therapeutic for me. But at the moment, I'm sort of thinking, oh my God, it's skin cancer again. So this is all part of that vicious cycle of health anxiety. It may well be skin cancer. It may not be. It probably isn't. 99% isn't. And I'm taking some cream because it could be a staph infection. It's been there a long time. Spots usually just come and go, but that's been there a while. And I think it's possibly because it's been in my moustache, and where you constantly so when you're constantly trimming it, it possibly causes slight infections, and it's still there. I just do not know. So again, it's all part of this process of self-checking, but you're constantly self-checking. It's not just a one-off. You're constantly doing it. I check for lumps, bumps, spots, zits, marks, you name it. It does my head in, and generally I find something, and then I panic about it, and I fixate on it, and then it goes on and on and on and on, and it's just this vicious cycle, and it's tiresome, and I think that's a lot of the reason I'm not sleeping. I feel good. I don't feel bad. So okay, I'm waking up at 3 o'clock, but I feel good. And actually, at 3 o'clock in the morning, 4 o'clock in the morning, I'm great. The woman I've been watching on YouTube that I was directed to did say that some people survive, or they've got a genetic predisposition to have less sleep, and it's fine. Don't worry about it. And I may be one of those people. I don't know, but I don't feel bad. I felt bad yesterday. I think because I worked a shift up until 9:15, and then I didn't have time to wind down, and then I just had about 2 hours sleep, so I was a bit of a mess yesterday. But today I feel perfectly fine getting up or being awake at 3 o'clock. I do try to get back to sleep, but it doesn't work. And as the lady on YouTube said, it's because your body's had enough sleep, and it's saying, look, you're awake, just get up and do stuff. So, I do try. So anyway, look, health anxiety. I had, about the IBS flare up I had. That was pretty bad. That was awful, actually. It seems to have calmed right down. A bit dodgy this morning, but I was eating things I shouldn't yesterday. Tiny bit of cauliflower, and that's clearly a trigger for me. But again, with IBS, it's all part of this anxiety vicious cycle. And that is an issue, a big issue. So everything is quite bizarre, because everything about the way I am is anxiety related. So, from spots to IBS to lack of sleep to, low immune system or whatever, it's really probably all anxiety related. And if somebody can crack that nut, I will be more than happy. Nobody's cracked it yet. I haven't cracked it, certainly. I mean, I think I've always been anxious, even as a child. And I think because I grew up that fat child, I always had anxieties. I always had low self-esteem, etc. And even though I've lost all that weight, which is a lot of weight, I've lost about 30 kilos, I still have those anxieties. And they manifest, I think, now in health. It never used to manifest in health. It used to manifest in other things. And so it manifests in different ways. And I've carried that anxiety around with me since I was a young boy. So many, many years. That fat kid at school was going back to, my first years at infant school at age 5. So I always had those feelings of low self-worth, really. What a long time, eh? 50 years. And I've dealt with them in different ways, obviously. I used to smoke. I mean, smoking was great for my anxiety. I never had anxiety when I had a cigarette. I used to drink. Never had anxiety. And I don't drink or smoke anymore. So you've taken away those crutches that used to get me through the day. And I don't have anything now. I mean, obviously, I video log and I blog and write, and I'm doing Lego actually. So I'm building Lego at the moment, which actually takes my mind off my anxieties, which is really good. And they're quite expensive, but you can't keep buying Lego to get over your your insecurities. But hey, whatever works, eh? And I've tried over the years many different things. I've never tried therapy, I have to say. So this is going to be an eye-opener, and I've got to just decide whether I want someone who's a novice or want an expert. So that's $170 or $300 a session. I don't know. Who knows? I can choose who I want to choose. I mean, it was quite bizarre because when I went to the doctors, and he said about a referral, and he said, "Do you have a preferred preferred group or whatever?" I said, "No, not really. In the UK, you wouldn't get that. You'd just be referred. But here, you can be referred to whoever your preferred group is, or who's recommended by your insurance company, for example." I am insured for that actually as well, which is good. So I shall probably start that next week or so, and I'll obviously let you know how that goes. I have got Japan on my mind, so I am planning that still, and so that's all good. That's keeping my mind elsewhere. so it takes my mind off fixating on my body, my sense of well-being, lumps, bumps, zits, and spots. Apart from that, it's been a pretty dull week, really, in Australia, which is kind of part of the course. Nothing happens here. As I said, I pick up on GB News for my drama and what's going on in the world, and then I come back to reality and dip in and out of Australian news and television very rarely, because nothing happens. Nothing happens in my life either. So it's, everything's very calm and measured. It's just my own head that's full of anxiety. So there you go. Anyway, look, have a good one. I shall speak to you next week. And again, any comments or any advice you want to give me, feel free. It's always welcome, because I can do with a lot of advice, especially now. And always good to talk to you. So, ciao.